guys, I'm Carmen, your host of the Myo Minute. I'm a myofunctional therapist with a large online global practice, and I'm happy you're checking out this episode. Today I'm talking about tongue ties. This is a hot topic recently as more and more educators like myself are getting the message out there about tongue ties, as well as more doctors and dentists are really getting up to speed on why tongue ties can be concerning and what should be done about them. So, what is a tongue tie? If you lift up your tongue and look underneath, right at the midline, you're going to find a band of tissue underneath, and that is called the frenum or the frenulum, depending on where you are. We all have this structure, but some people have a frenum that's really short or tight or both. Now, when the tongue is restricted, as we call it, the muscles do not function properly. This can cause concerns with speech, swallowing, sleeping, cavities, breathing. It can have other problems. The tongue is supposed to live in the roof of the mouth. So it's as if you took a piece of Wonder Bread and you squished it to the roof of the mouth. That's correct tongue posture. Now, as a myofunctional therapist, this concerns me because it prevents your tongue and the muscles from working properly. So for this reason, I always recommend that if you or someone you know or love has a concern with this, I encourage you to find a myofunctional therapist to talk with. Very often, tongue ties are overlooked or they're poo-pooed as being just fine or normal when they really aren't. There can be lifelong consequences for ignoring tongue ties, and I don't want you to do that. I do talk about these concerns in other videos, so you can find those here on this channel. So to wrap up this episode of the Myo Minute, there's really 3 things I want you to know. Number 1, what a tongue tie is. Number 2, that you can and you should do something about it. And then number 3, I want you to work with a myofunctional therapist both before and after. So that wraps up this episode of the Myo Minute, and I will see you in a future episode.